When I read this, I was like, ooh, my kind of woman. She lives in the right place. Susan, how did you get into powerlifting? You're just like a teeny tiny person from what I saw on the internet since we haven't met in person. I'm like, how the heck does she start powerlifting?
And I love it, I have to say. And I also do Pilates, but I started powerlifting about, gosh, I think 30, 40 years ago when I was in my late 30s, early 40s. I'm old now, but I wasn't at the time. And I was diagnosed with osteoporosis. And they told me, I'm going to be one of those women, I'm going to step off a curb and everything's going to crumble. So, I got terrified. So I looked up what do I do now? And it said resistance training. So I started powerlifting. And I mean, I guess I'm really competitive with myself because I like going from 2 pounds to 4 pounds. I can see the improvement. And then so I finally got up, pretty good. I was able to bench press. That's my best exercise, like maybe 60 pounds. And that, I mean, I'm only 4'10" and I'm 80 years old, 81. I just had a birthday. I can't believe it. But I'm this little old woman, lifting these big weights. But then I also started Pilates about 10 years ago. I have a leaky heart valve, and which no symptoms at all, but you're not supposed to lift above half your weight. So I only weigh 100 and I was already over half my weight at 60. So I thought I better stop.
Hello, everybody. Let me introduce you to our guest today. And it's Susan Salenger. She is the author of a book called Sidelined: How Women Can Navigate a Broken Healthcare System. With a deep dive into women's healthcare challenges, Susan highlights the internal conflicts many women grapple with when making medical decisions. She's not only an author, but also a passionate powerlifter. Susan has 2 fabulous daughters, 4 incredible grandchildren, a dog named JD Salenger, a cat named Max, and a tiny vineyard that produces Pinot Noir because she lives in the wine country. Welcome to the show, Susan.
Well, thank you so much. I wish I could give everybody a glass of my wine. That would be So I keep it up now, maybe just once a week, and I do Pilates 3 times a week. But I love it. Although, as I just told you, I canceled today. But
she was just saying, but when we started the interview, I canceled my workout, and I said, well, sometimes we have other priorities. And you said, right, rather than running myself crazy, going around and trying to get everything in, just take a breather and do what you need to do. And then you get back at it. No problem.
Well, and I really should say, I mean, in the interest of full disclosure, when I say I love it, I love what it does for me. I don't love exercising. That's what, I'll cancel at the drop of a hat, but I try not to. I mean, I'm pretty good. But I mean, for those people out there that say, well, I'm just not a gym rat, neither am I. But the best thing I can tell you for old age is truly you need to prepare for it. And the only way to do that is exercise. It keeps you, I move like a younger woman, and I give exercise full credit. So even though I really don't like it, I do love what it's done for me. And I want to give it, a starring role in my health here. I have 0 health problems, really. And at 81, that's pretty good.
Okay, did you guys all listen to what we just heard? Did you just hear what Susan just said? She doesn't really like exercise. She does it because it makes her feel good. She does lift weights. She does Pilates. And she is basically way younger than what she should be, air quotes, for her age. Because at 81, there's way too many people out there that are already on all kinds of medications. Right. And yes, sometimes we can't avoid it. But if you can, like she does, is the role model between my 62 and her 81. Yay, ladies. You got your work cut out for you between the 2 of us.
It's true. It's so true. And I'm only on 1 medication. I mean, I have high blood pressure, which is genetic. Both my parents did. I mean, that's remarkable for 81. It really is. I think the average, according to my research, is most women, well, not most people, take 4 or 5 medications daily.
Minimum from my clients. When I see what they have an organizer for the week with up to 10, 12 medications sometimes.
Yes. And 10 is not atypical. And then what happens is the medications interfere with each other. So medicine A makes your nose run, so you take medicine B as an antihistamine. I mean, et cetera, et cetera. And and
Very true. So,
crap.
Susan, we now know that you love, quote, air quotes, exercise because it makes you feel good.
Right.
But tell our listeners who you are, start wherever you want before we dive into your book. What have you done? Tell us paint the picture for us of who is Susan.
Well, that's a good, I'm finally beginning to figure that out, but I'm working on it. I'm a writer, I'm a grandmother, I'm a reader, I'm a gardener. I love just being home and, screwing around in the house. I trying to like to cook. My husband passed away recently and he used to be the cook. So I'm sort of relearning. I cooked all my life and suddenly I found myself just as a sous chef. I was just helping. And so now I'm trying to take back the major role, and it's a little tricky, but I'm doing it. Basically, writing and reading is who I am. And grandmother, of course, but my grandchildren now two of them are adults. Well, my God, three of them are adults. One just turned 18. So that's who I am. And I think the writing is the best way. I love it. It gives me tremendous satisfaction. And that is such a pleasure.
Yeah. What was the pivotal moment that inspired you to write your book, Sidelined?
It's an interesting question because it took place over a number of years and there were a number of things that came together. But years and years ago, when I was in my 30s, I had some exploratory surgery. I had changed medications and I started some vaginal bleeding. And the doctor said, after doing some tests, oh my goodness, we don't know what's causing this. You need surgery. And I said, it's got to be the new meds. I mean, I was fine before I took the new meds and I'm not fine now. I mean, it seems like it's not that tricky, but he did not agree with me and I got scared. So I did agree to the surgery, which they did. They found nothing. I went back on the old medication and of course all my symptoms stopped. So that was okay. I mean, I was mad at myself. I was not mad at the doctor. He did his best. And he was worried I had ovarian cancer. I mean, if he'd been right, he would have saved my life, but he wasn't right. And I thought to myself, why didn't I just wait? I just had so many options. Why didn't I wait a week or two? Why? I mean, there were so many things I could have done. But all right, life goes on. And then years later, after I retired, my husband and I had been in business together and we sold our business. And I'm hearing busy signals. It must be from something. Anyway, sorry. So we sold our business and that retirement did not work for me. It lasted maybe 3 seconds, actually. I was miserable. So I went back to school and I just took some classes. And for one of the classes, I did a paper on women who had hysterectomies. And much to my surprise, they too, or not all of them, but many of them had agreed to the surgery, even though they really didn't think they needed it. And that sort of triggered my own memories. And I just began to wonder how as women, how do we make our medical decisions? What goes into our judgment? Why do we do this? Agree to something like a hysterectomy. My thing wasn't that serious. Theirs was irrevocable, even though they really didn't believe they needed it. And I interviewed, I guess about 60 women to find out how they made their decisions, what they thought about being ill, about medicine. And 10 years later, I had a book. It took me quite a while to write.
10 years.
It did. I did a lot of research, a huge lot of research.
I appreciate that in your book. It's not a pamphlet. It is not just writing about the sidelines and the healthcare system's failures, especially as women are concerned. But you have really good examples. You really talk to your guests. You have data in there that's provable data, not just made up hearsay. So I really appreciate that in your book, that it was so detail oriented and thoughts through.
Oh, I'm so glad you said that because it truly, I mean, it's not a page turner. It's a book on health. It's supposed to be a resource. And I always recommend people that get the paperback, don't get the Kindle. You want it on your bookshelf,
Hold on. There it is. Okay, everybody, here it is, right there.
Lovely. Thank you very much.
Sidelined, how women manage and mismanage their health. And that's what we're talking about as well. So the book examines the paradox of women being proactive about their health, but yet they're struggling in the healthcare system. What do you think are systemic factors that contribute to this?
I think there are several, and one of the things I talk about in the book, and I will answer your question, I promise. But we really have to take charge of our own health, and the reason being, and here's the answer to your question: women's disease. We just know less about women's bodies than we do about men's bodies. Women's diseases, for example, get less research money. Prostate cancer gets more research money than uterine cancer, ovarian cancer, cervical cancer, and those are the women, our diseases, so to speak, are more fatal, but prostate cancer gets the money. And not only that, but women researchers get less money than male researchers. We're published less often than male researchers. So, I mean, think about that. If you're a woman researcher researching a woman's disease, you're going to find yourself at the bottom of the funding and publication barrels. So as a result, there's not enough information out there. I mean, there's a lot, and it's gotten better. It really has. But it's still, you're really kind of messed up before you even begin. And the other problem is, for years, and this has changed, but women were omitted from clinical trials. The 6-foot white male was the standard. In fact, I was just reading an article that they even use male rats instead of to test some of this stuff. So, I mean, even they don't even use female rats, for God's sakes, you know. But
I mean, it just blows my mind.
I
Just
know.
blows my mind.
I know. Well, and so as a result, women are, I mean, this happened to me and my daughter, who's actually 5 feet tall, weighs 98 pounds. We had to go for some sort of gastrointestinal test where you drink that stuff. And they gave her a thing, I mean, like a pint of liquid to drink. And I said, do you give this dosage to everybody? She seems awfully little for that. And they said, oh, no, we give it to everybody. So in other words, O.J. Simpson or Kobe Bryant get the same dosage as my 98-pound daughter. So, I mean, we drank half and that took care of that. But nevertheless, that's the problem. And I think that answered you, did it?
Yeah, I can only agree from my experience, and I've become a very picky person when it comes to doctors and their opinions of what we should do and what we should take as far as medication is concerned and so forth. And you addressed that in your book, and we'll dive a little bit into this in a little while. But I've like you said, there's like literally no research done on women. We always get the guy's dosage, like you just said. We always get what has worked for so-and-so, which usually was a guy.
Right.
And the little research that has been around for us is so minimal that we don't really know at times, does it work, doesn't it work? Because the test pool was so small.
Yes.
That it could go either way. But they're saying, oh, we had 16 women. And like, really? Seriously?
Yeah.
Over a course of 2 weeks. And the result was
exactly.
You're like,
yeah, you're absolutely right. And if you're a marginalized woman, I mean, women of color have it even worse.
Yep.
It's a lousy situation. It has gotten better. There are more women now. It's still it's about 50-50, but I don't know about women of color or other marginalized I don't know.
Other ethnicities. Yeah, that's true. Now, when you selected the women that you were interviewing for your book, was there resistance? Were there concerns that somebody may read their name, Mary Sue, in the book, or
no.
or that they actually didn't want to share? Although we women love to share,
yes.
But
they all were. First of all, I did. I changed everybody's name and location, so there's no way to recognize them. But everybody was so gracious and so generous. I got them off the internet. I just, went to various support groups and said, hey, I'm a writer. I'd like to interview you, etc. I got a lot of replies, and everybody all they wanted to do was help other women. And some of them did want me to use their name, but most of them did not. And I found that it was really nice when I wasn't using people's names. And I tried interviewing like a couple of my friends, and it's better to interview strangers and to keep their names private. One woman actually said to me, she started to tell me something very intimate, and she said, oh, I can tell you this, I'll never see you again. And that was true. And I got a lot of good information that way. And I think that that's really one of the secrets to interviewing, actually.
It's the intimacy, but yet they are there. There is this barrier of, like you just said, I will never see you again. So
Right.
who cares?
Yes, exactly. And she was right. And it was something, it was about hysterectomies. And I was really glad that she was having some sexual issues. And that's a typical side effect of hysterectomy. So I was really glad she shared that. It gave some life to my research. You know, it was a real life.
Real life stories from people that had this happen to them it underlines just what everything is said in your book. And you go, okay, this is not a made up story again. This is actually happened to this person,
right?
So-and-so. And this is so important, so we can see ourselves in the shoes as you painted in your book.
Yeah.
That we aren't, what I'm always about is we're not alone. We help, as women, we help each other out with the information that we know and have experienced.
Right.
So in your book, coming back, when you researched your book, what cultural history did you find around some of the topics, or maybe just one, or gender biases? I mean, we touched on the gender biases already with male, female, but maybe some cultural history. And I think of a specific one, but maybe you think of a different one today because it's a different day.
Well, cultural, I want to talk about gender bias. I didn't do cultural studies or cultural research as much as I wanted to. I actually started to, but how do I say this? Marginalized populations, minority women, there's so many different groups, and I had it all sort of broken down. I mean, Asian women versus Black women versus white women. And then somebody said, well, what about American Indian? And then somebody said, well, what about, I mean, I found myself going down a rabbit hole, because no matter how many people or cultures I listed, there was always one I'd left out. And that would be the culture of the person that was reading it for me. So I really just, all women have issues in the medical system. Certainly some have more than others, and the issues differ from culture to culture and from woman to woman. No, we're not all the same. I mean, I don't remember personally ever facing gender bias, but I'm certainly well aware that it exists. In terms of gender bias, I'm much more comfortable talking about that because I'm very familiar with the information. But it was funny because I was just studying my notes before we got on, and I was reminded of the study where doctors were given a list of a group of two patients of patients, a group of men and a group of women. Both groups had exactly the same cardiac risk factors and exactly the same cardiac symptoms, and both groups received a cardiac diagnosis. However, once stress was mentioned, only 15% of the women received a cardiac diagnosis. The other 85% were told to get therapy, were told other things. So the minute that stress was mentioned, that gender bias really came into play. We are still diagnosed with hysteria, which, I mean, stress is the new code word, but it hasn't changed. So gender bias is very real. It's very
so I remember the story in your book with women in menopause, and that they were sent to the doctor because they were freaking out, and that there was something wrong with us.
Right.
As always, something is wrong with us. It's not that it's really a medical condition.
Right. Absolutely. And that was incidentally where I did find some cultural differences. And I don't know if they're still true, but it was just for a sidebar from it was really interesting to me because women in Japan don't have hot flashes the same way we do. I don't know if that's still accurate, but at the time I did my research, I think they got neck pains. And women in the Yucatan have zero hot flashes. And women in Korea, I think, were cold or hot, one of the other. I mean, it was different. It was so different. And they don't really know why. It's not necessary. You'd think it was diet. And they partly, of course, but not totally. So it's just really interesting.
And these are good things to know because there's nothing wrong with us. As women always believe that something is wrong with me. I have this. And that the symptoms, let's take menopause, and you and I have been way past menopause, but I remember I had a relatively easy menopause. Others don't.
I did too.
And I always contribute that to the amount of exercise I was doing. Was I right? I have no idea. I have no
No, I
research paper,
never, wow, I never
but
thought.
but I always believed that exercise really helped me through the hot flashes, and a lot of the side effects of that, because I did exercise a lot back then as
Yeah.
well.
Yeah.
And I only knew when people were like, oh my God, I have this hot flash and the water's running down. And I said, you know what? The only time I feel I have a hot flash is when I'm sitting on my bike and my cheeks get really fiery red. That was my symptom.
My hair would frizz. I would have some really bad hair days. That was mine.
So, and I always credit it to exercise. Good, I could be totally wrong, and I could just be an incident. But you got frizzy hair, I got really rosy cheeks, so
Yeah.
there's got to be something to exercise.
I guess so. And actually, my hot flashes they lasted maybe a couple of months, and that, I mean, it was nothing compared to what most people go through.
Yeah. So when we talk about our health, explain what you mean. Why women mismanage their own health. What do you mean by that?
Okay, what I mean by that is we make a lot of decisions that in the long run we do ourselves a disservice. For example, women do about 85 or 86% of the caretaking in the entire world. We don't put ourselves first. We put our children first, our families first. And by putting ourselves last, I talked to so many women that, well, I just don't have time to go to the doctor, or the doctor gave me this prescription, but I don't have the time to get it filled. And that's the first thing that really struck me, because I don't see how you can take care of others if you don't feel good. Think about it. When you feel lousy, you're tired, you're irritated, you just feel crappy. You don't want to go around and help other people. It's the last thing you feel like. You want to crawl under the bed or into the bed. And I think I think putting ourselves last is one of the probably the most common way we do ourselves a disservice. And I think the second thing that we do that's also really a poor health habit is we hesitate to get second opinions. We don't want to hurt the doctor's feelings. We think the doctor's probably right. After all, the doctor knows best. I mean, they're the doctor. We're not the doctors. And we don't want to be rude. We've been socialized to play nice. And we don't, in fact, one woman told me that she was so afraid of being labeled a bad patient, if she said she would never ask for a second opinion. She was so afraid the doctor would be upset. That it was a male doctor at the time, and she said he would put it in her chart and it would follow her throughout her history. And I just have to take another sidebar for a minute, because there are so many diseases out there, roughly 40, 50,000. Those are the ones we know about. So you can imagine how many there may really be. And so many of the symptoms mimic each other. So if you go to the doctor and you say, listen, I'm really tired and I'm not sleeping and I'm irritable, and I mean, all of the symptoms that we all list, those fit, 90% of the diseases out there. If you have a broken leg, that's easy. Obviously, they take an x-ray. Oh, that's why your leg hurts. You broke it. I mean, but otherwise, really tricky for the doctor to make a diagnosis. It's like looking for a needle in a haystack. And I've talked to doctors about this, and the ones I've talked to, I mean, now this was for research purposes, but they said they were delighted when patients got a second opinion. First of all, they weren't always sure it was any diagnosis is the doctor's best guess. And if they got backup, it helps if there's ever a malpractice suit. So it helps them and as well as the patient. So I think that's. So I cannot stress the importance enough of second opinions.
And so you make a good point. We think doctor is God, doctor knows everything, doctor knows best, but doctor doesn't know 50,000 diseases.
No, they couldn't possibly. Nobody does.
And sometimes people say, oh, this doctor was terrible. He couldn't help me. Maybe it was not the right doctor.
Right.
And we needed to just look further and explore more and see how somebody can help us. And with a doctor, and I just when you talked, something came to mind. Is I just recently went to a doctor who had very, not bad manners, but he was condescending. And I can't say it, I don't want to say it on the podcast, what I really thought about him, but I was very condescending. And he was like, he knew everything and treated me like I knew nothing. But I mean, thanks to Google, I Googled all the terms that he was talking about and all the things. So I knew what it all meant if I didn't know. And in the end, we had another visit. He couldn't remember that I was there the second time. I was like, what? You can't remember that I'm here the second time? Really?
Oh, that's funny. Sort of.
It was sort of funny. It was ironic. And then he asked me these questions and I said, listen, you're not my therapist. My blood pressure is high because you let me basically wait for an hour in the waiting room, which is another thing that I am very allergic about.
Yes.
But then going back to what you said with the example, I'm a bad patient. After the visit, he wrote a report for my general practitioner, and he wrote in the report, just the way he wrote it was just like condescending. I gave her XYZ advice, but I doubt she will take it.
Oh my goodness.
And
oh my goodness.
Right. And it was something very simple. I'm like, you are not offering, you could say, I gave her this advice. End of story.
Right.
Not, I doubt she will take it.
Right. Right.
I thought it was unbelievably rude.
I do too.
And I haven't told my doctor yet that I will never go back to this doctor. And if I ever hear his name or anybody mentioning, do not go to this doctor.
Right, absolutely.
And that was one of those stories where, like, did he treat me like this because I'm a woman? Did he talk to me like I'm an idiot and I don't know anything? And I would just sit there and go, yeah, yes, doctor. Of course,
yes,
doctor.
Right.
But I had questions and he didn't answer my questions. So with that, okay, now this brings us to another question is, why are women reluctant to take a doctor's advice sometimes?
Because we know better and you listen to your gut. That's the message of my book. And I think it's real, and I have to say this, it's really important to listen to your doctor, but it's also really important to understand what they're saying and why they're saying it. And I think it's really important to ask questions. One of the statistics that really surprised me is 85% of women leave the doctor's office without fully understanding what they've been told. Think about that for a minute. You've been given a diagnosis, you've been given a prescription, let's assume, and you're not quite sure what the doctor said or why you're taking the medicine. And that is not a good thing, obviously. And one of the things I really recommend, and I want to segue into this now, is when you go to the doctor, I think a couple of things are really important. And one is to write down an agenda. And I mean write down. I don't mean have an agenda. I mean write it down. Because if you're like me, you're going to forget half of what you want to tell. Like I want to say him, her, they, whatever the pronoun is. You're going to forget a lot of it. And it's really important to write it down. So, you know, it helps focus the visit. And the other thing that I really want to say is ask for the clinical name of your diagnosis. Have the doctor spell it for you so that you can go home and look it up. If you have access to a computer or go to the library, whatever you have to do. But look up and see if you think it makes sense. Are the symptoms of that particular disease really what you're feeling? And you need to really think about that. And I think a really important question to ask the doctor is, I understand you think I have disease X. How did you arrive at that? I mean, what else could it possibly be? So that if you're lucky, he'll say, well, you know, I'm thinking of this, or she'll say, it could have been that. And you'll have a couple of things you can go home and look up.
Oh my God, writing down so important. Oh my God, this is so important. And you said you're 81, I'm 62. I make myself a list. I get there and I don't remember because I get flustered and then they do exams and ask you.
I'm so busy trying to be a good patient. Sometimes I leave the office. I can tell you more about the doctor than he can or she can tell about me,
Yeah. Yep. And that's not very good for what we're trying to achieve, right. Staying healthier.
Exactly.
As we're aging. Now, when we're talking about the healthcare system and how it sometimes undermines, or we undermine our own healthcare Why does this happen? What do you think that we ourselves, I mean, you said, I don't go pick up my meds, but what could be another factor be that we undermine our own health?
Well, I think, again, putting ourselves last is definitely one way we undermine ourselves. But I think equally important is so many of the women that I did talk with felt ashamed of being ill. They felt that it interfered with their quote. Oh, well, you can't see me quote, can you? I thought that maybe
you can't do the quotes because they hear the quotes, and we have the video for those people who watch
right.
the video.
So they think it's their duty to take care of everybody, and they're failing in their duty if they themselves become ill. And there were so many women that told me they were too embarrassed to call the doctor. This was one of my most fascinating finds, and it's going to be my second book. But so many women blamed their illness on stress, and that was one of the reasons they felt ashamed, because they felt that they were so stressed, so overstressed, that's why they got sick. It didn't matter if they had breast cancer, lupus, chronic fatigue. I mean, I talked to women who had all of those. Different women, not one woman didn't have all of those, and they were so sure that they got ill regardless of their disease because they can't manage their stress. So they saw their sickness as, oh my gosh, she's sick. It's a public acknowledgement that they can't manage their lives. So they didn't even tell people most of the time that they were sick. So I think shame is a really big reason that women do themselves sometimes a disservice. Of course, it depends on the woman. It depends on what the symptoms are, etc. This was so interesting. I put together a couple of focus groups, mostly because I just wanted geographical diversity, because the women that I was interviewing were in California, which is where I live. And in the group, I had hired a facilitator that's what you do when you have focus groups, and we barely needed her because the women were so eager to talk to other women about their illness. Most of them had never talked with anybody about their illness other than their doctor. They were so ashamed of being ill that they just kept it private. So in the focus group, where they were not only allowed to talk about their illness but supposed to, I had women with different illnesses, but so many, I mean, it didn't matter. The problems were the same, and they were so glad to hear that other women were having similar experiences regardless of their disease. So I thought that was fascinating.
Yeah, I have like my own focus group. I have a brick and mortar studio for Pilates and strength training, intermittent fasting, and nutrition here in Maryland, aside from my Pursue Your Spark brand. Yeah. And so I see people in person, or at least on Zoom, or a combination of both. And I have like my own little focus group because people have learned to trust me so much over the years. And my clients are not come and go by season. They've been with me for a long, long time. Yes. We are hashing out all kinds of stuff.
Exactly.
And the neat thing is I'm the hub. So if one person comes and tells me how she treated gout, let's just use gout.
Yeah.
Just came to mind. Another person says, I think I have gout. What do you know? I'm like, oh, wait a minute. I know about this, and this is what this woman did.
That's exactly, yes. That's exactly what happened.
And so there was this whole cross promoting of what can we do to stay healthier. Right. And what have you tried? Have you experienced that? Have you experienced this? So this is really eye-opening, isn't it?
Yes. And I think that as women, or maybe men too, I don't know, but I think as women, we forget how random illness is. I mean, some people get COVID and some don't. And some alcoholics get liver disease and others don't. I mean, I exercise, I watch my diet, I have high blood pressure. My father-in-law never exercised, ate nothing but red meat, and his blood pressure was lower than mine is even with my meds. So I mean, go figure,
Who knows, right?
Exactly.
So what action steps can women take to make sure that they receive the best care possible, Susan?
I think the first thing they can do is take control of the doctor visit. I am going to repeat myself because it's critical. Make a list. Have the doctor write down the name of your disease so you can go home and look it up. Repeat back in your own words what you hear the doctor say so that you are very sure that you understood correctly. And take somebody with you. It's so important to have another pair of ears because, again, I get very anxious and I can't hear. So I think those are 4 steps that are really concrete. And I think that they're techniques that will really help you get the diagnosis that the most accurate diagnosis. Again, you want to ask, what else could this possibly be? Why did you arrive at this? What were you thinking? How did you get there? All of you want, again, it's a question of fully understanding what you've been told. And if the doctor brushes you off, that's a clue that maybe you need to find another doctor. I don't know.
Good point. Don't be afraid to find a new doctor. The doctor gods are not going to come down on you and dismiss you.
Yeah, look at what happened to you. I mean, that's incredible.
I will never go to.
I had something similar at UCLA of all places, and I have nothing but respect for them. But I just went to have a biopsy on a cyst, as it turned out. I mean, it was nothing, but nevertheless, they did the biopsy, and I didn't know it was nothing. So I said, I only asked one question. I mean, there was nothing to ask. I knew I was having a biopsy, and I just asked something about if it is malignant, what's the next step? And he said, why don't you just leave the driving to us, and walked out of the room. What? So that was another doctor that, I mean, I never went back to. I mean, come on, really?
No, no, that's a hard no from this end too.
It is.
No. No.
And I just want to add, I don't know what our time schedule is here, but just another quick little story about how important it is to make sure that you listen to your intuition. My mother was about 75 and in perfect health, not a senile bone in her body, and just went in for some knee surgery. I mean, no big deal. She was an outpatient. They gave her some medicine for a little pain, and she came home. And within about 24 hours, she couldn't remember her name, didn't know where she was. Oh my God, it was so frightening. I can't tell you. She couldn't, I mean, it was one of those, she didn't know who the president was. So of course we called the doctor immediately, and we said, something's wrong, this, whatever. And he got off the golf course, I mean, literally. And we met him at the office, and he took me aside and he said, Sue, I know you're a close family, but your parents are aging and you're making them feel bad. You need to let them age graciously. And I said, Steve, nobody gets senile overnight. I mean, you're right. They are aging, but come on. One day she's terrific. The next day she doesn't know who she is. I mean, really? So we threw out her medication and she was back to normal. She was allergic to something in the meds. But my point being that if my dad and I hadn't listened to our own intuition, we would have kept, the doctor wanted to keep her on the meds. And I mean, I'd rather she be in pain. She took a Tylenol or whatever she took, and it was okay. But so you got to listen to your guts. That's really the moral of the story.
So that brings me to, in what way do you feel doctors overemphasize procedures or drugs?
Well, that's a loaded question. Yes. Do I think so? Yes. And I think there's some really good reasons for it. I mean, there is better living through science. Let's face it, drugs have done some wonderful things. But, compliance is such a difficult issue. And so many patients will go in requesting a drug that they've seen on television, and the doctor really wants to give it to you, because if he gives you something you're asking for and he or she or they think that you need some, you're more likely to comply if it's a drug that you've requested. And malpractice is also a very big problem. And we talked about that before. And I also think that, now on Yahoo or wherever, doctors get rated. So they want to please their patients. And many times patients will, if you don't give them something, they will walk out of the office thinking that you didn't believe them. I mean, there have been studies about that. Yeah. They did a study where people went in with, I don't know, stomach fake people, researchers went in with complaining of stomach issues, and those patients that were told they had a stomach ache went out much less happy than those people that were told they had gastroenteritis, because they felt with the scientific name, they felt that the doctor had really heard them. If they were told they had a sore throat instead of laryngitis or something, they felt that they hadn't been heard. So that's another answer to it. It's a complex problem.
Because in my studio, I teach my clients, or in my practice, I teach my clients the real words, the big words, as I like to call them, and then the words they can remember things by. Like, like you said, laryngitis, my throat hurts. Just remember that the two go together. If you hear this, this should make sense. And it's like you said earlier, knowing the big words, as I like to call them,
yes, they are,
is good, because you can Google then and educate yourself about this. If you put in sore throat, you get all kinds of things on the internet.
No, it's true. And there's which I forgot to mention, I'm not a good sales lady, but there's a resource list at the back of my book. I've done the research for you. Google's great, but the internet is full of misinformation. But there are specific sites you can go to research your doctor, to find out where they were trained, to research your hospital. Some hospitals are good for cardiology, some are good for neurology. You want to know who you're going to, where, if there is a problem, they're going to send you to. And it's all there in the back of the book. I have it all categorized, how to check your drugs, how to check everything. I've really done, that took the most work.
Really good job. Like I said, you did a really good research. I appreciate that a lot.
Thank you. Yeah, I did.
Well, it's your book. It has your name on it, and it's got a new cover, and it's like, it's.
Yeah, we even changed the name because women thought now it's how women can navigate a broken healthcare system.
Yep. Which brings me to two more questions for you. What are 3 ways to manage a broken healthcare system? If somebody listens as a final takeaway, what are 3 ways to manage that broken system for us as women?
Take charge of your health. It's your body. You only have one body, and take care of it. Be sure you ask the doctor questions so that you understand fully what they've said. And third, do your own research so that you know very well what you're getting into. You don't want surprises. There was a study done where women who were having surgery never researched either their particular surgery or the surgeon who was going to perform it. Yet we spend 8 hours researching a car, 10 hours researching a new job position. So we seem to, again, put our health last. Don't do that. I'll end on a negative. You want to I'll end on a positive. You want to put yourself first.
Put yourself first, yeah. Now, Susan, what is the question you wish somebody would have asked you that you have been interviewed from or with? Is there a question that you said, I wish they would ask me this, and nobody asked me that one?
No, not really. I've been interviewed so many times, but like yourself, they've been so thorough. People have read the book. They've really asked similar questions, but you had a particular take on it somehow. I wish there was one woman, one interviewer that did not ask me about the shame, and I thought that was one of the most important things in the book. As I don't feel ashamed when I'm sick. I get angry at the world. Do you? Oh, that's hilarious.
Me too.
I get pissed off.
We were meant to meet, I swear to God.
I think so. It's hilarious. It doesn't occur to me to be ashamed. I'm not in this world do this to me. I have so many places to go and people to see.
And things to do. That's right. I'm planning a trip. We're going tomorrow. We're leaving for Portugal. I got no business with other things.
Exactly.
Oh my God. This is fantastic. Susan, it's been such a pleasure talking to you and hearing more about your book. Where can people reach you and get your book?
Well, my website is susansalenger.com. Salenger is Salenger. And the book is available. Well, it's on Amazon, of course. The world is on Amazon. And you can get it at any independent bookstore. If they don't have it, they can order it. It's available wherever books are sold.
Yes, great. Thank you so much. We'll put the link in the show notes for you guys.
Great,
So you
thanks.
don't have to pull over to the side and write things down or whatever it is wherever you're listening to this episode. So we love it that you joined us, but we also want to hear from you. I would like you to reach out to me at heike@heikeyates.com and type the word sideline, just like Susan's book, sideline, into the subject line and write to me how this episode impacted you, how you felt, what questions you had. What do you want to know more about? And I can connect you with Susan, of course. And she's also
Sure.
all over social media. And once we post the episode on social, you can do the same thing there. But I really want to know. We're recording these episodes for your health, for your benefit. And I'm bringing experts in like Susan to help you live better in your second half of life and make better choices and see the options that you have. So email me, reach out, keyword sidelined. So Susan, thank you so much again. And it was a pleasure.
I enjoyed thoroughly. I really enjoyed being here. Thank you.